Hi, everyone. I'm Dr. Fairuz here. So, we are in the midst of a pandemic of corona, COVID-19, and a lockdown. Nevertheless, we are reinforcing on ourselves positive vibes of good habits, good mental and physical health, which is very essential at this time of a challenging situation like this. Today, we have with us Dr. Sanjeev Jain, who is a senior psychiatry professor of National Institute of Mental Health and Neuroscience, NIMHANS, Bangalore. He is a researcher who is nationally and internationally acclaimed and is an expert in psychiatric genetics and history of psychiatry in India. He leads one of the largest national program on the biological basis of psychiatry in India. So we have certain questions to you, Dr. Jain. Thank you very much. On behalf of All India Ophthalmological Society, I extend my sincere gratitude towards you for accepting this invitation and being with us today. So the questions for you today, apart from all the discussions that we had, is the absolute do's and don'ts to maintain a right psychological balance and good mental health. Welcome, Dr. Jain.
Thank you, Dr. Feroz, for inviting me, and it's a pleasure being here in this difficult time, and I'll try to be of whatever help I can at this point. Now, this obviously situation has two kinds of responses for psychological and mental health. One is for those who have been diagnosed or are suspected to have the disease. For them, we need to offer psychological first aid, which is nothing more complex than offering reassurance, comfort, concern, and empathy, and making sure that the basic needs are being fulfilled and there's a concern for their future welfare. Now, this assurance and the availability of this assistance and this confidence goes a long way in building up their resistance and helping them come out of this potentially traumatic situation. On the other hand, at this point in time, we are all in a state of social isolation. Now, this, of course, gives rise to a very odd situation for us because human beings are social animals. We need and crave for social contact all the time. But this critical situation, which we hopefully are in for a few weeks, needs to be handled at different levels, at a personal, family, and a social level. At a personal level, of course, it's much simpler. We must learn to keep a steady schedule of exercise, both mental and physical. Do the things that we enjoy doing. If we have a hobby, find time to spend time doing that. Do the things that we have enjoyed all our lives, like reading or gardening or reading or organizing our personal affairs. Make things and do things with your hands so that there is some kind of diversity in your day-to-day routine, and try not to brood too much on the consequences of this fear that is now going around. Make sure at a family level that jobs and chores are shared. There may be both overcrowding and loneliness depending on the living situation, and you have to adjust to that situation for a time being. Make sure that things get along smoothly and that you look out for the others who may need your help more critically, like the very young or the very old, and make sure that as a group you build some degree of cohesiveness within the family. Once that is achieved, the social connection and the social isolation needs to be countered with a sense of social belongingness and cohesion. Reach out to all your friends, family, establish contact with everybody you know, inquire about them, do things for them if you can from a distance, make sure that they are all safe, and keep engaged in their lives and their distress. Even talking to others and talking about how they are coping improves their health, improves your health. So make the social connectivity a part of your life. If possible, try and reach out and help others who may be less fortunate than you, whether in the neighborhood or in society at large. We have to get over this together. If fear is contagious, so is hope, and so is courage, and so is optimism. Communicate this hope and optimism to everyone around you, because this is, after all, just a disease, and we as doctors have been battling disease all our lives, and we should be able to do that with the same degree of confidence as we always have.
Absolutely. So, are there any specific don'ts that we should be taking care of?
Well, the obvious don'ts are the ones which everybody is insisting on. Do not touch your mouth, eyes, nose. Do not follow the instructions being given by the public health authorities. Make sure that you follow all those instructions and do not act in transgression of that. Do not make unnecessary trips outside. Do not socialize. Do not try and have a kind of quarantine party, at least taking food and spending some time with your friends. So do not do that. At a personal level, make sure that you do not brood unreasonably or irrationally about this. This is a disease much like any other infective disease, and with sensible precautions and with the full knowledge and habits, we can manage to prevent and break this chain of transmission.
Thank you,
Do
Dr.
not,
Jain.
thank you.
So what I understand from this is in this phase of physical, distancing, social connection is very, very important, and the feeling of togetherness as a society and
Yeah.
helping each other probably helps
Yeah,
us to maintain a good mental and psychological balance. Am I correct?
absolutely. Absolutely. It's not only essential to maintain this, it's essential that we do not lose it, because after 3 or 4 weeks, we'll need to get back to each other. And
Yes.
it'll be very important to know that we are getting back to a group of people who did look after us, were concerned about us, and in times of distress, we were able to maintain a connectivity and a communication with all the people around us.
So we
We are
remain
going to get
hopeful.
back into full society now.
Yes. Thank you very much, Dr. Jain. Once again, on behalf of our society, All India Ophthalmological Society, I extend my extreme gratitude towards you for being with us today. Thank you so much.
Thank you very much. Stay safe, stay happy, and be confident. Thank you very much.
Thank you so much.
Thank you.